What antibiotics are prescribed for various infections? Prepared by the editors of website netbalist.ru. Attention, this presentation is informative. Antibiotics are taken only after consulting a doctor. In case of local infection with such disease as prostate abscess, lymphangitis, dental abscess, the causative agent of which are Pseudomonas aeruginosa, Proteus, Enterococcus, Gonococcus, Escherichia coli, beta-hemolytic Streptococcus, Streptococcus viridans, anaerobic Staphylococci, penicillin, oxacillin, ampicillin are used, also erythromycin and cephaloridin. With genital infection disease, the causative agents of which are Pseudomonas aeruginosa, Proteus, anaerobic bacteria, Enterococcus, Escherichia coli, Staphylococcus, often hospital acquired, Streptococcus with such disease, adnexitis, metritis, perimetritis, pelvic peritonitis, postpartum infection, with infection with resistant hospital Staphylococcus, a combination of oxacillin with gentamicin, zetomycin, kanamycin or penicillin is used. Urogenital infection. The causes of genital urinary infection can be chronic prostatitis in men and chronic cystitis in women, as well as Proteus-infected lithiasis. Novobioacin or chloramphenicol are used. In urinary tract infection, the pH of the urine is very important. At acidic pH, the following drugs are active: natural and semi-synthetic penicillins, nitrofurantoin, nalidixidic acid. And at alkaline pH, the following drugs are active: gentamicin, kanamycin sulfate, and erythromycin. What about acute and chronic urinary tract infection? The causative agents of an acute form can be Enterococcus, Proteus or intestinal Ballantidia, and the causative agents of chronic form can be Pseudomonas aeruginosa, Klebsiella or Proteus. For the treatment of several cases are used kanamycin sulfate, colistin, gentamicin, cefalexin, and ampicillin. For the treatment of less severe infection, sulfonamides, nitrofurantoin, mandelic acid, cycloserine, nalidixidic acid are used. For a more effective impact, the following are used: combination of sulfonamides, ampicillin in combination with gentamicin, ampicillin with kanamycin sulfate. What to do with acute and chronic genitourinary infection in case of renal failure? In such situation, rifampicin, cefalotin, or oxacillin, which is less toxic, are used. What about intestinal and stomach infection, among which are such disease: dysentery, enterocolitis, acute diarrhea, gastroenteritis, acute gastritis, colitis? For healing are used sulfasalazine, colistin, neomycin, streptomycin. In severe cases, kanamycin sulfate, oxacillin, penicillin are used. Staphylococcus enteritis. In this disease, the following drugs can be used: kanamycin sulfate, rifampicin, erythromycin, cloxacillin, or oxacillin. Bacillary dysentery. The following drugs are used to treat this disease: tetracycline and levetiracetam, chloramphenicol. In typhoid fever, the following antibiotics are used: cotrimoxazole, ampicillin, chloramphenicol, levomethacin. Cholera. To eliminate cholera vibrio are used chloramphenicol, tetracycline or cotrimoxazole. Amoebic dysentery. Tetracycline, quinolin derivatives and metronidazole are used to treat this disorder. Salmonellosis and Staphylococcus intestinal infection. For the treatment of such disorders, the overuse of antibiotics should be avoided, the use of which is necessary only in severe cases. What about respiratory viral infection? The fact is that these diseases are viral, which is why antibiotics are ineffective. Candidiasis. As a rule, such disorders appear in patients treated with broad-spectrum antibiotics. To eliminate candidiasis is recommended equation with a weak solution of soda, local use of such drugs tamiflu help with intestinal candidiasis, oxyquinolin derivatives, intestopan, chlorquinolidol, amphotericin B. Anthrax. Everyone is familiar. To treat this disease, simply colossal doses of penicillin are used. Gonorrhea. To eliminate gonorrhea, the following drugs are used: tetracycline, streptomycin, rifampicin, erythromycin, penicillin. How is actinomycosis treated? For the treatment of actinomycosis are used penicillin and cotrimoxazole. Mycotic form of tonsillitis. For the treatment of mycotic form of tonsillitis, the following drugs are used: stamicin and nistadine. Angina or blood disease. For the treatment of such disease are used penicillin, chloramphenicol, levomethacin, sulfonamides. Diphtherical pharyngitis. For the treatment of diphtheric pharyngitis are used tetracycline, cephaloridin, ampicillin, erythromycin. Ulcerous membranous angina, Simonovsky-Plou-Vincent. The following antibiotics are used: phenoxymethylpenicillin, penicillin V, benzylpenicillin, penicillin G. Streptococcal benzylpenicillin is used to treat streptococcal pharyngitis. For the treatment of bronchitis, such antibiotics are used: tetracycline, ampicillin, cotrimoxazole. Bronchopneumonia. The causative agents of bronchopneumonia can be Klebsiella pneumoniae, Pseudomonas aeruginosa, Proteus, Haemophilus influenza, Escherichia coli, Enterococcus, Staphylococcus, Pneumococcus, Streptococcus. Depending on the antibiogram, antibiotic therapy is prescribed: cotrimoxazole, ampicillin, penicillin. Pneumonia. If there are difficulties with the diagnosis, the following antibiotics are prescribed: cotrimoxazole, penicillin, ampicillin, tetracycline. But in case of pneumococcal streptococcal pneumonia, the following are used: benzylpenicillin, tetracycline, erythromycin in case of an allergy to penicillin, or cotrimoxazole. Haemophilic pneumonia. With pneumonia caused by Haemophilus influenza, the following drugs are indicated: levomycin, tetracycline, ampicillin, erythromycin, or sulfamethoxydiazine. Klebsiella pneumonia. In case of pneumonia caused by Klebsiella, the following drugs are prescribed: gentamicin, kanamycin sulfate, or streptomycin. Staphylococcal pneumonia. With staphylococcal pneumonia, the following drugs are used: cephaloridin, oxacillin, methicillin, erythromycin, or penicillin. Pneumonia caused by gram-negative bacteria. For the treatment of this form of pneumonia are used cotrimoxazole, sulfoxazole, polymyxin, gentamicin, kanamycin sulfate, streptomycin, cephalosporin, or ampicillin. Mycoplasma pneumonia. For the treatment of mycoplasma pneumonia are used tetracycline or erythromycin. Q fever caused by Coxiella burnetii, tetracycline and levomycin are used. Ornithosis, psittacosis. The following drugs are used: cotrimoxazole, streptomycin, tetracycline. Acute brucellosis. The following therapy is used: tetracycline in combination with streptomycin and cotrimoxazole, depending on the situation. Cholecystitis. The causative agents of cholecystitis can be Pseudomonas aeruginosa, Streptococcus, Staphylococcus, Salmonella, Klebsiella, Enterococcus, Escherichia coli. The following drugs are used: rifampicin, tetracycline, novobevacin, erythromycin, penicillin, ampicillin. Bacterial endocarditis. The following antibiotics are used: benzylpenicillin and streptomycin and kanamycin sulfate or gentamicin. Bacterial endocarditis caused by penicillin-resistant staphylococci. In such situation are used rifampicin, vancomycin, fuchsidin, cephalosporidin, methicillin or oxacillin. Erysipelas caused by Streptococcus, sulfonamides and penicillin are used. Recurrent fever caused by Borrelia spirochetes. Penicillin is used. And what about the flu? Influenza is a viral disease, and in viral disease, antibiotics are contraindicated, and they can also harm. The use of antibiotics can only be in case of secondary bacterial infection. Giardiasis. Metronidazole is used to treat giardiasis. Leprosy, cyanosis, caused by Mycobacterium leprae. For the treatment of this disease are used sulfadimitoxin, streptomycin, kanamycin sulfate, cotrimoxazole, sulfone. Benign inguinal lymphogranulomatosis. For treatment of this disorder are used tetracycline and sulfonamides. Meningitis. Meningitis can be caused by such pathogens: Mycobacterium tuberculosis, Pseudomonas aeruginosa, Proteus, Salmonella, Escherichia coli, Haemophilic influenza, Enterococcus, Staphylococcus, Streptococcus, Meningococcus. Treatment is complex, including antibiotics. Meningococcal, streptococcal, or gonococcal meningitis. For the treatment of this form of meningitis are used cotrimoxazole, ampicillin, or penicillin. Pneumococcal and enterococcal meningitis. For treatment of this form or meningitis are used cotrimoxazole, ampicillin, or penicillin, or with cotrimoxazole and streptomycin or kanamycin sulfate. Hemophilic meningitis caused by Haemophilus influenza. For treatment are used ampicillin with streptomycin or kanamycin sulfate. Meningitis caused by Escherichia coli. Ampicillin and streptomycin or kanamycin sulfate or gentamicin is used to treat this type of meningitis. Pseudomonas aeruginosa meningitis. For treatment, the following drugs are used: polymyxin colistin, gentamicin or carbenzylin and kanamicin sulfate are used. Staphylococcal meningitis. For treatment, a combination of penicillin, kanamicin sulfate and oxacillin is used. Otitis, mastoiditis and sinusitis. The main causative agents of this disease are Staphylococcus, Pneumococcus, Streptococcus, Pseudomonas aeruginosa, Proteus, Escherichia coli, Haemophilus influenza. For treatment are used ampicillin, penicillin, kanamicin sulfate, rarely due to ototoxicity, streptomycin less often due to ototoxicity. Acute articular rheumatism caused by beta-hemolytic streptococcus. For the treatment of this disease are used penicillin, corticosteroids, aminofenazone, acetyl salicylic acid, aspirin. Rickettsiosis caused by such pathogen: Rickettsia prowazekii, Rickettsia quintana, Coxella burnetii. It is treated with tetracycline or levomethrin, but less often. Salmonellosis. There are typhoid fever and paratyphoid fever. They are treated with chloramphenicol mainly, ampicillin and cotrimoxazole. Scarlet fever caused by Streptococcus. Penicillin is used to treat this disease. Sepsis. The main causative agents of sepsis can be Proteus, Klebsiella, Pseudomonas aeruginosa, Escherichia coli, Enterococcus, Staphylococcus, Streptococcus. For treatment it is used benzylpenicillin or ampicillin and gentamicin or kanamicin sulfate and oxacillin or methicillin. Staphylococcal infections. There are such diseases: sepsis, meningitis, endocarditis, enteritis, osteomyelitis, purulent pleuritis, lung infections, phlebitis, metritis, phlegma, abscess, mastoiditis, otitis, tonsillitis, pyodermitis. For treatment, benzylpenicillin and oxacillin or methicillin and kanamicin sulfate is used. Streptococcal infections. There are such diseases: sepsis, meningitis, endocarditis, phlegmon, abscess, lymphangitis, bronchopneumonia, acute articular rheumatism, nephritis, scarlet fever, sinusitis, otitis, tonsillitis. In case of beta-hemolytic streptococcus, the following are used: benzylpenicillin, erythromycin, cephaloridin, ampicillin. The following drugs are used in case of Streptococcus viridans: kanamicin sulfate, streptomycin, erythromycin, benzylpenicillin, ampicillin. Tetanus. In the case of tetanus, a combination of diazepam, tetanus anatoxin, and in some cases penicillin is used. Toxoplasmosis caused by toxoplasm. The following drugs are used to treat this infection: Daraprim in combination with cotrimoxazole or sulfamethoxydiazine. Trachoma caused by Chlamydia trachomatis. for treatment of this infection are used penicillin preparation, sulfonamides, or tetracycline. Trichomoniasis caused by Trichomonas vaginalis. Treatment is with metronidazole. Whooping cough. In case of infection with Bordetella pertussis, the following drugs are used: tetracycline, erythromycin, or levomycin, chloramphenicol. What about variola? Smallpox. And in the case of smallpox, antibiotics do not help because smallpox is a viral disease and antibiotics are contraindicated. That's all. Thank you for your attention. This material was prepared on the basis of the site webnetbolezny.ru. This video is provided for informational purposes only. Before using any methods and means, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.